Hi everyone, welcome to the webinar. We'll get started. I see there's a few people joining as we speak. I'm Jacob, I'm one of the co-founders of AccuRx. And just before we dive into the demos and other people in the team take you through the main things you're probably here for, just want to say thanks a lot for joining. Appreciate everyone's incredibly busy and they haven't really had a proper bank holiday. As you probably heard us mention before, our aims through this are really to help you keep your staff and your patients safe, to help you keep your routine services running, and to help you support your team move to remote working. And we're continuing to build more features that will be coming out over the next few weeks to help with that. As always, please do keep the feedback coming. That's how we know what to build. And I'll pass over to Annie in a second, who'll just talk you through how to ask questions on this webinar. We'll try and cover all of them, so do just send over anything you'd like us to cover, and we'll cover those at the end of the call. We're going to cover a handful of features that have been released recently, photos, documents, remote monitoring, some of the new templates, video consultations. But if there is anything else, do please send that in the questions as well, and we can try and cover it. I'm going to hand over to Annie now, who will just take us through some housekeeping. Annie, over to you.
Thanks, Jacob, and thanks everyone for joining. Yeah, just going to go over a couple of housekeeping things before we get started. The first is that this webinar will be recorded and also posted in our Facebook group and YouTube channel, and we'll have links for that at the end of this. And thank you also to everyone who emailed me some pre-submitted questions. Hannah and Chuka will be answering these throughout their presentations. There is also a question and answer function in the webinar, and we definitely encourage you to use it. If you'd like to ask a question that someone else has already asked, please do use the upvote function. We do have a lot of people on the webinar, so this will really help us to prioritize what questions to answer first. And also it helps us keep that Q&A box a little bit more tidy. If we run out of time and aren't able to answer all the questions, we'll make sure to have all the answers available in our support center, and we'll show you how to use that at the end of this as well. Okay, so now I'm just going to pass it to Hannah, who will start demoing how to allow photo responses from patients.
Great, so I'll just share my screen so that you can see what I'm doing. So you should see a version of EMIS up on your screen. This is a dummy EMIS, all dummy patients. We have a dummy patient mini mouse open, which I'll just use for this demo. All of our systems do work on both EMIS and System 1. So I'll be doing these demos in EMIS, but if you're a System 1 practice, you should also be able to use all of these features in a very similar way. So the first one we're going to look at is allowing individual patients to respond with a photo. So this was something that came up while we had launched video calls, and people fed back that sometimes the quality of the video call was not good enough to be able to take a good look at a rash or a skin mole or potentially even a sore throat. So I'll just show you how you can allow a patient to, rather than doing a video call, also be sending in a photo. So to do this, you open up the patient that you would like to request the photo from. Usually the patient demographics are pulled through and the mobile number would be here, as you know. And you can type the message such as, please send me photo of the rash you have. And then we have this little checkbox here at the bottom, which is allow patient to respond once with text or photo. So if you tick that, a link will be added to the bottom of the message. The patient will then be able to use that link to submit a photo. So we will just send that message to Miss Mouse. Once it's sent, you will see that message come up in the patient's SMS history. So you can just see, we'll use for this demo to look at the link, but for the patient side, they would be seeing that on their mobile device. So we'll click on that link to see what it would look like. So, hi Minnie, your practice has asked you a question. Use this form to submit a response and or add a photo if requested. The survey is operated by AccuRx, and that's a link to our privacy policy. And then are you happy to proceed? So if the patient is happy to proceed, they would then enter their date of birth. This is how we verify that the correct patient has received the correct link. and that there's not potentially an old mobile number or something else, so that we can ensure that the right patient is getting the right question. We then redisplay the message that you sent. So please send me a photo of your rash. And I'll say the rash is on my left hand. And then the patient would click here, attach photo, and then they would be able to upload a photo from their device. Clicking on this choose a photo button would launch either the library or the camera on a smartphone. So whatever the mobile device allows, we launch that. So because we're on a computer, we'll launch the Windows file picker. So I have a nice photo here of some flowers that we'll just use for the demo. So you can see a preview of that photo. The patient can then remove it if they decided that was the wrong photo, and then they can carry on and either review their answers or submit it. So upon submitting, there's a message that the patient is given, and they were given also a SMS to say what the follow-up steps will be. And then those responses will come into the patient response team. It might take a couple moments for it to come in, but when it does, there'll be a little red notification first on your initials. Yep, there it looks like it came in. And then on the patient response team, there's now a little red notification. So when we click on that, we can then look at the response. So the responses come in here, and if we click on the photo will then display, and we can either choose to download that or use that as a way to further the diagnostics for the patient. Currently, if you click this button, the text response will be saved. We are in progress of working on a way to also save the photo to record. So that's not currently available, but that should be available within the coming weeks. So we've now saved the text there to the record. So if we update Minnie's EMIS, we can see that the response came in and that the patient attached a photo. As I said, we will be looking to also be able to save the photo to the documents section of the patient's record, but we don't currently have that just yet. If you have any questions about this feature, please do write in the chat, and we'll make sure to address any of those questions as they come up. The next feature I will demonstrate is about sending documents to patients. So this is in quite a similar way done. We will be demoing with a sick note. So this has been a highly used feature in the last couple of weeks in the COVID pandemic. So in order to attach a sick note, you can either use a template, similar to any templates that we have in the AccuRx list or you have for yourself or your practice, or you can just type a message saying, find your sick note attached. You then would select attach file, and it opens your Windows file picker. So I have then saved onto my desktop a sick note for Minnie Mouse. That then attaches that link, and it instructs that the patient would need internet on their phone in order to access it. There's a lot of questions around the ability to send sick notes. Annie mentioned that we will be looking through our support center a bit more. So this is, if you're familiar with it, support.accurx.com. We have an article specifically about digitally signing sick notes, and we have some clinicians who provided resources on how to do this. So you can see this article here, which is linked from the AccuRx article, and then also on our YouTube channel. We have a video from an AccuRx user who's instructed how you can send duplicate fit notes and then be able to text them to patients via AccuRx. So you can see that I've attached that sick note, and that's right there. If we now click send and save, we will see the patient's SMS history. And if we were to click on that link, we should be able to then see the sick note that has been sent to the patient. The patient needs to, again, verify their date of birth, and this is to ensure that the correct patient is getting the correct information, given especially that sick notes can be quite sensitive. And then you can see that sample of the sick note. Again, questions on that, please do send them in the chat. And then in general, questions about signing digital sick notes. We do have this article about digitally signing sick notes on our support page. So please do take a look at that. And yeah, let us know if that helps answer your questions. The next couple of features that I'm going to show are some Florey questionnaires that we have for helping both triage and monitor patients that have potential COVID symptoms or have been discharged from hospital or potentially are COVID patients. So to access those, you would click on the Florey tab. We have here the drop down of the different Florey questionnaires. So we have the COVID remote monitoring questionnaire and the COVID triaging questionnaire. The triaging questionnaire is one that you might be familiar with. We've had this one around now for about 3 weeks, 4 weeks maybe. So this is the one we initially rolled out in order to help triage patients that were set to do face-to-face appointments in order to understand what type of risk profile they had of potentially being having been exposed to COVID. So we'll send that one. We'll see the link here in the SMS history, and I'll just take a look at it so that we can look at the questions in the survey. I believe 111 advice was recently updated, so we will be updating questions along to fit that. But here you can just see the example of what that questionnaire looks like. Again, we use date of birth to verify the patient's identity. So please select any symptoms. They can select high fever or temperature or new continuous cough or neither. So we'll say that Minnie has both of those. Are you so ill that you've stopped doing your usual activities? Yes or no. Does anyone in your household have a high temperature or continuous cough? That's talking about exposure. Have you traveled outside in the UK? This one we will be removing, given that it's not really relevant to the NHS 111 advice anymore. And then we'll be updating our clinical team is updating any of the other questions, so that should be coming out next week. And then if you submit that, there's then a warning displayed about in order to give patients the information that they would need in terms of if they're experiencing symptoms and what to do based on their living situation. So along with the NHS 111 advice, that's basically word for word, but framed in, again, a patient-centric approach. And the responses to that questionnaire will come into the COVID-19 team. So if you click on the COVID-19 team, you should be able to then see Minnie's responses have just come in here. So you can see she has a continuous high cough and a high temperature, that she's too ill to continue her normal activity, and she has been in contact with fever or cough. So you can decide to click save that to the record. None of these things are being saved with SNOMED codes currently. In order to roll it out quickly, we're having it just save as free text, but we're hoping that this can be a useful tool that clinicians can use in order to understand the potential risk factors that their patients have been exposed to. So you can see here is that response saved to record. The second questionnaire that is a bit newer, we've only rolled it out about a week ago. And again, in continuous update, ensuring that we are aligned to the NHS 111 advice, is this COVID remote monitoring questionnaire. So this is a questionnaire that we've set up specifically to help with patients that maybe are discharged early from hospital or are at home and self-isolating with potential COVID cases, that a clinician would then, rather than having to potentially call them every single day, that they would then have a questionnaire that they could fill, and based on the responses of that questionnaire, the clinicians can make the call on if they require a daily call or if their condition seems stable. So we have a little warning here that this is a 24-hour questionnaire. Most questionnaires Florey questionnaires that AccuRx has are 7 days. So this is a much shorter questionnaire, given that the responses are expected to come back much quicker. And then you can add repeat dates to this. So to add repeat dates, we can say, okay, we want to have this patient monitored for 1 week, but the practice is closed on Saturday and Sunday, so we will remove the Saturday and Sunday dates. Then we have that patient being monitored for 1 week. In the same way, we click send and save. So this is now queuing up all of the messages that are being sent. You can see this little status here. It says queued. So we need to go to the first one, which was sent just now. So this is the only one that's been delivered. So we click on that questionnaire, and I'll just quickly take you through the questions in that questionnaire. Again, these features are all available for anyone. So if you would like to give this a test for yourself, please do bring up a dummy patient and put in your own mobile number so that you can go through the questions more in detail for yourself. So how do you feel today compared to yesterday? We'll say same. Do you feel more breathless today? We'll say yes. Can you complete a full sentence without having to take a breath? Yes or no. Do you have any new symptoms? We'll say sore throat. And then if they have any of the equipment, they're able to provide different types of readings. So we'll say that Minnie only has a thermometer and her temperature is 38.8. Oh, looks like she has a bit of a fever. So we submit that. We have the NHS 111 warnings specifically about seeking urgent medical attention if there are any of the following symptoms. This is, again, because this questionnaire is likely going to patients that either are confirmed COVID or potential COVID, and it's monitoring them so to ensure that if their symptoms do worsen quickly before these questionnaires responses are reviewed, that they would then seek the urgent medical attention that they would need. So these responses are now going into the COVID-19 monitoring team. So if we click on the monitoring team, we should then see Minnie's responses here at the bottom. So we see here are Minnie's responses. If we then click save to record, that should then save directly back to her medical record. Again, most of these answers are not coded. We were able to add in the code for blood pressure. Technically, that was a bit simpler to do. We will probably look at doing the same for temperature, but currently the answers for most of the responses here are not coded. And that's just for the ease of us being able to get the responses back quickly. If you have thoughts on different SNOMED codes that you think would be relevant to have in these questionnaires that you use in your practice, we're always really interested to hear more about them. The last little feature I wanted to show is something that we've rolled out recently that allows you to join and leave teams. So if you look at this left-hand pane here, you see a section at the top called My Teams, which has a set of teams, and then Practice Teams, which has another set of teams. And then if you look at the middle column, there's this button that says Leave, or if I click on it, it has now moved from My Teams to the Practice Teams. And if I click Join, it moves back up to My Teams. The difference between being in a team and not being in a team is getting notified about it. So if your role in the practice is that you don't want to be the first one triaging inbound responses, you could potentially be leaving all of these teams, and then only during maybe your admin time, you would then come in and then look at which teams have new responses coming in. So you can see that the COVID team has a new response and that you might want to take a look at that. Currently, we don't have the ability to allow practices to create custom teams, but that could be something we look at in the future as we are doing some work to revamp the mailbox, given that we know that there's a lot of messages coming in and it can be kind of confusing sometimes where different messages are. So we're working currently to make that a bit more straightforward, but for now, this does allow individual users to join and leave teams. Another question that we get quite a lot is about if an admin person or a practice manager could manage the team status of everyone in the practice. Currently, we don't allow that. It is based on the individual user. So me as one person at the practice would need to set up what teams I join and what teams I leave. But potentially in the future, that could be something that we change. Right now, for most inboxes, the default is that if you send a message related to that inbox, you will be automatically added to that team. And then if you were to leave that team, even if you send another message that's related to that inbox, it would remember that you've left. So that could be used, for example, if an admin person is sending out, say, an asthma questionnaire or a COVID triaging questionnaire to many patients, but the responses are actually being reviewed by a clinician, the admin person maybe wouldn't want to be re-added to that team all the time in order to see those notifications because they're not relevant to that person. So that's just the logic that we've put in there. But again, this is something that is a work in progress and that we're currently continuously working to improve. But that's what we have so far. So again, questions on that also welcomed in the chat. And I think that's all I have. So I'll pass it over to Chuka.
Hello, everyone. My name is Chuka. I am a product manager at AccuRx, and I'll be demonstrating the video consultation feature. So I'll need to take control of Annie's screen because I was having technical difficulties with my own computer. So as I request remote control here. So here I'm now, so here with the AccuRx toolbar, and I'm in the system one. So here I click on the video consultation, and up pops Mr. Osbuckby. So here I'll put in my own phone number, so it will call me. So now that's enter. I have the option here to join from my smartphone. This is where you would get the option where will be sent a link to your phone to join the video consultation, or you can currently do it from your computer. So when you select this computer option, there will be a box that appears under it here that goes through a check of you have all the right tools for video consultation from your desktop. First being your webcam for video, your microphone so that the patient can hear you, and that you're using a supported browser from the latest versions of Google Chrome, Firefox, or Microsoft Edge. So let's just go ahead and see. We have the message text here, the template of starting a video consultation. So from here, we'll do send and save. So that text has been sent to my device, and I'll be getting a text shortly. So once you've sent it, you're taken back to the thread here, and you now see that you can click the link below to start the video consultation. So I'll go ahead and click this button, this link, sorry. So this opens my browser, and goes into Whereby, and I'm dropped right in, and there's Annie, there she is. So on the patient side, I get this text as before. I click on the link. I request permissions. And there I am here, so talking to Anna. And that's from here, you'll be able to conduct your video consultation. So no, that's how to do video consultations easily from your desktop. Bye, Annie. So that's the core flow. And when you click here, leave, that's it. So yes, so that's video consultation from your desktop. So this will make it a lot easier to be able to conduct video consultations for people that want to do it from the computer because it has a properly configured device. Thank you so much, and I'll hand it over to Annie.
Thanks a lot, Chuka and Hannah, for demoing that. I realize we've all covered a huge amount in about 20 minutes. So I've got a long list of questions here that people have sent in both before and during the webinar. So I'm going to make my way through them. If I haven't understood your question properly, please do just send it in again, make it a bit clearer. But I think I've captured most of them. Let me just add that one there. So from the top, we had a few questions about general setup. So can I use the same AccuRx account at one practice? Yes, you can. The way you do that is when you're in the second practice, you just need to click on the toolbar and log in with the same details. If it's an EMIS practice, you do need to be enabled in EMAS Manager as with your first practice, and we do have a support article on that as well in our support section, which we'll show you shortly. Then next general question. I previously asked if AccuRx can work across more than one system, one module, and I was told this would be passed to the development team. So this is a question about if you've got two windows open at once, so either two EMISs or two system one windows open at once. So that's quite tricky for us to handle because we don't know who the current patient is if you've got two different patients open in different windows. So I know that with EMIS, we ask you for the patient. If you've got two windows open, you've got to search for the patient. I'll need to double check on exactly how we handle that with system one. But yeah, unfortunately, we don't know the current patient if there's anyone open. Got someone asking about charges in the future. So as people know, the whole service is free, except some areas are paying for text messages for the extended package, and there is now NHS England funding for text messages. In terms of the longer term, we're not targeting selling practices, so we're working with NHS Digital. We're one of the first suppliers on the new G30 Futures framework, so that we can be procured centrally in exactly the same way that EMIS and System 1 are paid for centrally. Had someone say they don't get the options coming up for attachments or templates. If you see that, it could be one of two things. So it could be you're not an approved user, and that every time someone joins your team in the practice, they have to be approved by your AccuRx admin, who gets a notification on their toolbar. So check if you've been approved yet. If you definitely have been approved, then what's most likely is you need to update your AccuRx toolbar. So we do update automatically, but sometimes different NHS IT permissions block that from happening. So you can do that from the About section of the AccuRx menu. And again, that's covered in the support section of our website. So then there were a few questions about messages. So one around the delay of messages. So previously, any messages sent between 6 PM and 8 AM, we would automatically delay until the next working day. The same goes for messages sent on Saturday, Sunday, and bank holiday. We've actually changed that behavior. So we've changed it in two ways. So one, the delay is now 7:30 PM till 7:30 AM. So any messages you send after 7:30 PM, before 7:30 AM in the morning, you'll get a checkbox that's ticked to delay it. You can untick that checkbox if you want to send it immediately. But if you're going through blood results or doing things late at night and don't want to disturb a patient, then if you leave it on, it will send it at 7:30 the next morning. We've also disabled that for bank holidays because practices have been staying open throughout the bank holidays to meet the demand and continue to serve their patients. Got a question: does a patient need to sign a consent form to confirm they're happy to have SMS sent to their mobile number? So that's down to each practice in terms of how they manage it. We definitely wouldn't recommend that because that's an incredibly high admin workload, and also isn't necessary. So if you look at GDPR, the legal basis for practices messaging their patients will be the delivery of healthcare under a public authority, and actually the ICO advises strongly against public authorities using consent as a legal basis for processing data. The main thing we'll say here, because there might be other reasons you do want to check with patients, is just be really aware of what you're sending to a patient and what's appropriate. So if you've got a test result that someone has an STI, you're probably not going to want to send that over SMS unless you've confirmed with the patient that they're happy to receive it in that way. Or if you're breaking bad news, you're probably not going to want to do that by SMS. Whereas either if you've spoken to a patient about their blood test results and they're happy to receive them, or it's something sort of more innocuous, they've got low vitamin D and you want to tell them to go to the pharmacy, then that's likely to be fine. So that is a decision for each practice to make, but we generally say, you guys all know your patients really well, so use your common sense there, your judgment. Any work on sending bulk text was one question. So not at the moment. There are obviously other services to do that. So most practices are using MJOG or iPlato for that. Maybe something we do in the future, but at the moment we're focusing on these other features that other platforms don't offer. Then we had a stack of questions about photo responses. So there were a few about saving photos that patients send to the record, to the medical record. So that is something that we're working on. We don't have live yet, but in the interim, there is a video that I believe Dr. Gandalf did and is on YouTube on how to do that. And it also includes reducing the resolution of the image because EMIS and System 1 can't handle the file size of photos that are taken on modern smartphones. But that is something we're working on. That link remains available on AccuRx. So even if it's not saved in the record, when you open the message history in AccuRx, you'll be able to open it and see that message. Somebody's asked how to embed the rash or wound photo seen via video consultation. So we don't have a way of capturing photos during video consultations. We have actually done some work to improve the quality of a video call. the image quality to make it easier to see rashes. And the feedback on that has generally been very positive, but obviously a still photo taken is going to be higher quality. So you may want to ask a patient you may still want to send them a text and ask them to send in a photo. The only workaround, if you do want to capture it from the video, would be to screenshot your computer and to save that photo and add that to the record. Got a question: can these photos be used to send blood glucose readings? So I mean, they can be used to send anything. So you could take a photo of a document if someone's captured it on there. They're obviously going to have to be read from that document or manually transcribed. You can also use the patient response for that. So if you wanted to collect, I understand obviously blood glucose readings might be more of a diary over time, but if you wanted to collect one-off readings, you could ask that as a question, allow the patient to respond. Is this GDPR compliant was one question. Yes, it is. So we're very strict internally and have a very high bar for how we process data. And that's all outlined in our data processing agreement, but our data security goes way above and beyond what NHS Digital requires. So it's absolutely fine to be using this for patient identifiable data, whether that's in the photo or in the response that a patient sends. Got a question: if we download photos, will this end up on our desktop? That depends on where you save them to. So when you just download a message, if you do download it, you can choose where to save it to. Can patients send only one photo? Yes, they can only send one at the moment. If that's something that, if there's really good reasons to send more than one, do let us know. We're always trying to improve things, as you know, so do keep us posted. And then a question about photo file size. So the photo is too large to attach to the records. Is there an easy way to reduce size? So there in Windows 10, where if you've got the photo open in the photo viewer, if you go to the options, there is an option to reduce file size. In Windows 7, it's probably easiest to use Microsoft Paint and then save the image as a JPEG. But as I mentioned, we are working on being able to save the photo into the record. So those were all the questions we had on photos. If you feel I haven't covered something on messages or photos, please do send it in, because I'll keep going through the questions that are coming in. Then we had some questions on video. So is there a way of watching back a video consultation after it's finished? So unfortunately not. We don't record any of the consultations. Why do half my video consultations result in a patient saying that their camera and mic are blocked? So the most likely reason that a patient's camera and mic will be blocked is that they're on a phone call at the same time as they open the link. So if you're speaking to a patient on the phone doing a telephone consultation, and then you want to move over to video and you send them a link, if they're on the phone when they open that link, they won't be able to use the video consultation, and we need to make that a bit clearer in our software. So once you've sent the SMS, hang up and let them click the link. Obviously, if they do have problems connecting, you can call them back up. The main thing we'll say on this is we're really trying to improve the success rate of video calls. It's quite hard because it works differently on every different patient phone. So the most helpful thing for us here is if you can feed those things back. So we are rolling out a patient feedback form, but if you can let us know when it hasn't worked, we can look into it. Because obviously we've tested it on the range of phones that we have within the team. But the more we get exposed to, the more different scenarios and devices and things we can troubleshoot for. Please can share how we can use video COVID with people in residential care who don't all have a mobile number. So the best way to do this would be if you want to do a video consultation with someone in residential care. If there's someone, a care provider there who you can do it with, you could send the link to their number. The other option would be to copy the link. So once you've sent it from the message history in AccuRx, to copy the link, paste it in an email, and you could send that over as well. Does video consultations use the clinician's mobile or the computer? So as Chuka showed, you've got two options now. So you can use your own mobile, and some people really like that because it's effectively like having a second screen, so they can have the EMIS or System 1 full screen. And you don't need a webcam on your computer or a headset or to have, Google Chrome or anything like that. But also a lot of people like to do it on their computer because the internet connection might be better. They can see the image larger on their screen. So we support that as well. You just need to have the right hardware on your computer. And then we had a question about, can we be able to see a larger image of the patient? So when you have the video consultation open, on the image of the patient, there's 3 dots in the corner. And if you click on that, you can maximize the image there, and they'll appear larger and you'll appear smaller. A question of, is share room useful? So if you do want to share the room with another party, some of the examples where people have used this is if they want a patient's family member to be able to join, or they want another care provider, for example, someone in district nursing or the hospital to be able to join the consultation, they send the link to them as well. Or another example that's come up quite a bit is with interpreters. So if you're using an interpreter service, you can also send the link to them and they can use that for the consultation. So we support at the moment up to 4 participants in a video consultation. Those are the questions I've got at the moment for video. I'll go back through and see if any more have come through since starting the questions. Then we had a range of questions around sending documents. So the first one was, we would like to have an electronic asthma action plan so that we have the same version sent to the patient as is in the notes. Is this available? So if you have any document, it could be an asthma plan, it could be something else in the notes, you can save that to your file system and attach it to an AccuRx message. We are working on being able to just attach directly from EMIS and System 1, but that's not currently available. So you'd need to save it to the file system and attach it. But that can be for any PDF document, and we do support other document types, so images and Word documents and things like that. Somebody wanted to check if it was possible to send documents from EMIS and System 1. So as I mentioned, that's something that we are working on. Is it possible to create and attach a merged shielding letter? So we don't currently have any sort of way of mail merging and bulk sending letters. That is something that we're looking at for longer term, because we've had a very high open rate of documents sent through AccuRx, much higher than in fact Post is, has been shown to have. So we'll be working on support for better batch flows. Then a question of, can we send an uncompleted respect form for patients to discuss with family and return to us, partially completed, and then completed and signed respect forms for patients to keep in their homes. So any document that you have in your system, again, you can send to a patient, and it's, they can then decide to send it to their email or to print it out or things like that. So you can send those documents. Same question, we've been asked about referral letter. So again, you can attach that. Nothing we've built is specific to fit notes. We demoed that as an example, but you can attach any file to a patient. Some people have asked about adding a document to a template. So if there's something that you often want to send out the same document, for example, it might be an advice leaflet. The way we'd recommend doing that is not actually to send it as a document in AccuRx, but to upload it onto a site like Dropbox or Google Drive, because it's the same for every patient. So it doesn't contain patient information. And then you can just put the link to that document in the template. And that also makes it easier for the patient, because it means they don't have to put in their date of birth, and it will be available indefinitely instead of for 14 days. And then someone asked a similar thing around sending document from EMIS to System 1 for sick notes, specifically concerned around human error. So if you are, when you do save documents from System 1 or EMIS onto your desktop, into a downloads folder, 2 things would say is, 1, clean it up. So, after you've then attached that and sent it, do delete it, and don't just leave them all accumulating on your desktop. But the second is do label it, because if you don't, and I know, for example, EMIS just puts a string of different numbers and letters, it is very easy to accidentally send the patient someone else's sick note, which would obviously be very bad and would be a data breach, a potential data breach. So do make sure that when you save any documents to your file system, you make it clear in the title who that document is about, so that when you attach it to the right patient, and make sure that your team are doing that too. As I mentioned, we are working on ways to attach it more directly from a medical record system. Right, and then so those were most of the questions we had around documents. So things like attaching straight from EMIS and System 1. Then we had a few questions about remote monitoring. So one was, are you alerted if a patient does not respond to the monitoring questionnaire? So yes, you are. I believe that's after 24 hours, but Hannah, to correct me if I'm wrong. And we do also send a reminder message if it hasn't been completed after 2 hours and after 6 hours.
Yeah, that's all correct.
Great, thank you, Hannah. Some people have wondered where the questions have come from. So one of our clinical leads, Vivek, who is also a GP 1 day a week, he spoke to about 25 GPs in developing the questions to make sure they were a good balance of thorough, but also patient friendly, and that they made sense. So that's where they've come from. If you do have any feedback on the questions, do please let us know. We want to keep improving them. And then we've had a question, if you're waiting for several photos from different patients or monitoring from a number of patients, is there any notification that patients have responded? Yes, there is. So providing you're part of the relevant team, so it could be the patient response team or the COVID monitoring team, you will get a notification. You're automatically added to that team when you send a message of that type. So if you send a COVID triage questionnaire, you're automatically added to the team that gets those notifications. But as Hannah demonstrated, you can join and leave that team. Everyone can still see all of the teams. So even if you're not notified, you can see that. So what we'd recommend is having a process where someone in the practice at the end of each day is just looking at the different teams and checking that they're empty. So the best way to manage these is to archive responses once they've been dealt with. So they'll show as unread for everyone. So even if you've read it, it will still show as unread for a colleague who's part of that team. But once you've archived that response, it will be archived for your colleagues too, to avoid any duplication of work. So do make sure you use that archive and check any things that haven't been archived. Are we able to create our own teams is one question. And yeah, as Hannah mentioned, that's not something we currently support, although do kind of give us more feedback if you think there are cases when that would be useful. As the teams grow and more people send things out, we are also working on assignment, so that when a response comes in, you'll be able to assign it to a specific either member of your practice or to specific teams. You might, for example, assign it to reception or something like that. Are we alerted to Florey questionnaire responses if we are not in the patient's notes? So yes, you will be. You don't need to be on that patient, or in fact, to even have EMIS or System 1 open, you do just need the AccuRx toolbar open and for AccuRx to be logged in. And for most people, the AccuRx toolbar will open and close when EMIS or System 1 open and close. So as long as you can see the toolbar, you'll get a red dot with a number in it to symbolize how many notifications you've got. So do keep an eye on that. We've had a question about patient responses of, if you work 2 days a week, who will look at the follow-up answers? So that's why we've implemented these all as teams. So instead of responses to ad hoc messages or to monitoring questionnaires going back to the person who sent them and only to them, that's why we have this concept of a team, so multiple people can see that. Both people in the team who get notified and people who aren't in the team. So it's completely fine to send these if you're not at work for the next 6 days, as long as you've got other colleagues in that team who can look at that, or not in that team, but who are checking all the teams to see what responses haven't been dealt with yet. It is going to be really hard to manage responses if you don't use the archive function. So if you let hundreds of patient responses stack up, it's going to be very hard to know what has been dealt with. So please do make use of that, and do let us know if there are other ways you think we can make that clearer. Then we had a question of, is it possible to mark a patient response as unread if it has accidentally been clicked on so that it doesn't get missed when reviewing? We don't currently have that, but again, that's where we would recommend, if you archive things when they're dealt with, you'll know that everything that hasn't been archived hasn't been dealt with. And the unread behavior applies to each user. So even if you've read a message, it will still show as unread for your colleagues until it's been archived. Then also on patient responses, somebody said they can only see 3 teams: asthma, failed SMS, and patient responses. So once you click on any of those, you should see all teams in the left-hand sidebar. If you don't, please let us know. It might just be that no messages have been sent of those types, but you should see them all on the sidebar. Let us know if not. I'm just going to open up other questions that have come up since I started going through those. So just bear with me 1 second. Okay. Do I need so I'm going to continue the question. So do I need a webcam with my computer, as not all the remote working has that facility? So no, that's why we support using your own phone. So when you do a video consultation, you can send a link to your own phone. And if providing you've got a smartphone, which most people do, you can use the webcam on your phone. Your phone number isn't shared with the patient. We just simply use it to send you that link. Someone said, if we do a video consultation with a smartphone, does it depend on reception or signal of your phone? So yes, it does. So you'll need to either have Wi-Fi or data on your phone, both you and the patient. And then you'll also need to have some phone signal to get the SMS message through. So it works if you've got Wi-Fi, but very bad phone signal, as long as you've got a bit of phone signal getting that SMS through. In some areas, people just do it entirely on phone signal. So it does vary. But if you just have no phone signal and no Wi-Fi, then you would need to use it on your computer. Somebody said the video link goes to a different browser, which is not acceptable. How do I change the browser settings? So yes, it won't work with old versions of Internet Explorer. It needs to be on a modern browser like Microsoft Edge or Google Chrome. I believe there's a support article on how to make Chrome the default browser, but if there isn't, we can put one up. Or if you just Google set Chrome as default browser, they'll have that answer. If you don't want to change the default browser, the other way to do it is going to be to copy the link in the message and then paste that into the right browser. Sometimes patients need to enable camera and microphone, but they don't know how, as it's not clear. So as I mentioned, it's most likely if they follow the instructions that they get, that it's because they're on the phone at the moment to use. So do hang up before they open the links. You can send them the message, but do before they open it. Do hang up. And then somebody said, can we go through the video consultation again? So we're going to put a recording of this webinar online afterwards. So I think it was at around 20 minutes in that we went through the video consultation, but you'll be able to look at that. We do also have a range of videos on our YouTube channel showing different things like how to do video consultations. So do also look at them. What do you do when you don't have Wi-Fi in the surgery? So if you don't have Wi-Fi in the surgery or any signal on your phone, you would need to use your computer to do that. Unfortunately, there isn't anything we can do if you don't have a webcam on your computer and you don't have any signal or Wi-Fi on your phone. Unfortunately, there isn't a way around that. NHSX have been speaking with the telecoms companies, including BT, to try and accelerate both internet provision in practices and internet access for NHS staff. So there is some information available on that online. A question around getting funded centrally through which GP framework someone's asked. So that's through the new GPIT Futures framework, which is replacing GP SOC. Somebody couldn't get video consultation working. It looks like it's because they didn't have a webcam, but it sounds a bit specific, so do just message our support team. Can AccuRx also be installed on remote EMIS on a laptop? Absolutely. So you can just install it from our website there, and lots of people use us in that way. Any suggestions regarding headphones and microphones? So I don't think we've got any. I know some people are using Jabra headsets, some people are using Empower headsets. If anyone has a really good headset that they'd recommend, please send it in, and we can, or put it on the Facebook user group, and we can spread that so people can see that. I know it's quite hard to find headsets and webcams at the moment, just because so many people, not just in healthcare, have moved to working from home. There's been a surge in demand. Somebody said when saving a Med3 print to PDF on EMIS often crashes. So we have heard of this. Apparently the workaround is to, instead of going straight to print, is to go to print preview. And then once you're in the print preview, then print to PDF, and that prevents it from crashing. And so thanks to our users who found that out. How do we get notified when a photo or questionnaire is returned? So you'll get a red dot on the toolbar. Have we spoken to pharmacists who'd be interested in our product? So yes, we do have a number of pharmacies using us. We've got a standalone product called Fleming, which you can just use in the web browser or on your phone. So please do tell colleagues in hospitals, mental health, physiotherapy services, pharmacists, community healthcare. Please do tell them about Fleming, because they can use us to do video consultations and to message patients. Does using your own phone use a lot of data? So we've been told it's between 5 and 8 megabytes a minute. So it's unlikely to be a problem for patients, because it's you know, they're just having a single consultation. Obviously, if you're doing back-to-back consultations throughout the day, then that's when we'd definitely recommend being on Wi-Fi, so that you're not using a lot of data. A number of the phone networks have said that they're going to offer NHS staff unlimited data on their mobile phone plans, including their personal mobile phone plans. So if you just Google that, NHS unlimited data, and then your phone network, you'll see that. I think EE was the first one, but I believe they're all planning to follow on and do that over the coming week. Someone says these questions are really helpful. Can you add them to your FAQ? So most of these should be in our support section, but do please tell us if there's something missing there, and we'll add them. Yes, pharmacists can sign up if they have an NHS.net account, someone's asked. How is it best to attach a link to an EMIS mentor document? So if it's a link on a website, you can just put it in the message. If it's a document on your computer, you would need to add it as a file. We obviously do have the nhs.uk lookup. So if you're sending an SMS to a patient, you can look for something from nhs.uk. Right, how to set up Teams. So I believe you'll only see Teams where, if you've never sent that type of message before, Hannah, is it the case that you won't see a team for that message type until somebody sent one?
That's correct. Someone at the practice needs to have sent one of those Flory types for that team to exist for everyone at the practice. And then
Great,
once
thanks.
it exists for one person, it would exist for everyone.
Thank you. Yeah. So if you can't see an asthma team, it's because nobody in the practice has yet sent a Flory for asthma. So once somebody sent that, it can just be to a dummy patient and your own mobile phone number, then those teams will be there and others can join it. Do we need to save documents in a folder? Yep, you need to save them somewhere on your computer. So somebody said, how can we add this to our system? So I don't know if you're already a user of AccuRx, but if you are, then you already have all these features there and they're at no cost. If you are not, then you can just download and install from our website. Is the person who sent the message individually notified that the message has come in? So if they're part of that team, they will be, and so will everyone else in their team. So we, as I mentioned, we don't just notify the sender, we notify the whole team in case somebody's away or something like that. can clinicians from multiple practices be in the same team? So that's not something we currently support, but we are. We will take that away and look into that. It's an interesting use case. I think the main challenge will be around information governance and how much can that user from another practice see, and how is it managed. Some people saying when they use the smartphone, it's blocked. It could be, if it's on your phone and you're on NHS Wi-Fi, it could be that your network settings are, the firewall is blocking our service. If that's the case, then do contact our support team. We've got a bunch of instructions for your IT team to unblock that. The best way to diagnose that will be, if it works when you're on 4G, but it doesn't work on Wi-Fi, then that's probably something to do with your firewall. So we can look into that with your IT team, but again, you need to just let us know. Video consults can't be saved to the notes, they're not recorded, but just the SMS that goes out is saved to the notes, obviously. Is there anything we can do when patients have run out of data? No, the main thing to say is most patients will be at home at the moment. So if they've got Wi-Fi, then they can use that. But also a single consultation or a few consultations aren't likely to cause a patient to run out of data, just because you know, a one-off consultation doesn't use that much. It's more if you're doing back-to-back consultations as a clinician that you could use more data. I don't have attached file, somebody said, so you need to either update your toolbar or be approved, as we discussed before. Yes, so somebody's asked if they can use the camera on their laptop instead of their phone. We showed that in the demo, so instead of choosing my smartphone, you can just choose this computer. Somebody said they use different computers. They need to download AccuRx on each computer. So it does need to be installed on every computer, but only once. So it doesn't need to be installed for each user on each computer. Once somebody's installed it on there, it'll be on there for everyone. The way we recommend doing that is putting the install file in the shared drive and then running the install on each computer. And you can use your same login details on every computer. Obviously, if you are adding more people and you're in an EMIS practice, you will need to enable them on the EMAS manager, and so get your practice manager to do that. Somebody said, why do I have to download AccuRx every time I log into my system? You shouldn't have to. That sounds like your IT department is blocking something. So do get in touch with our support and we can pick that up with them. And if anyone's having similar problems around it not updating properly or having to reinstall it, that's an issue with how your IT department is essentially trying to block our software. So we can pick that up with them. So somebody asked why not use Skype or FaceTime. You can do. I guess the challenge is if you use that, the patient is going to have your details. So that's why we've built it in this way to send an SMS out directly. Some nice feedback coming in, which is very nice to see. The team do enjoy that, so please do. If you have good things to say, do share those too. I think those are most of the questions. Can you use Fleming by itself without EMIS? Yes, you can. That's what it's built for. I think data sharing agreements between practices in PCNs and AccuRx. So, that's an answer to the information governance question. Thank you for that. Great. IG toolkit question, please. I don't know what the question is, but somebody says IG toolkit question. So we have an up-to-date IG toolkit. You can look it up on the IG toolkit website, and it's also on the security page of our website. And we do a number of things as well to ensure our security. So we do penetration testing, and we have cyber essentials, and take security very seriously in our team. So I think I've covered all the questions. Oh, no, more have come in. So some questions about updating COVID triaging, which we'll look into. Can we attach a voice recording of my answers? So the recording of the whole webinar will go online, so please do look at that. But we are also, we'll make sure most of these questions are covered on the support section of our website, so do have a browser there, but we'll add any that aren't. Annie, did you want to just show people what that looks like?
Yeah, absolutely. So yeah, I have some links up here for everyone. So first is just to our YouTube channel where well, you can see the recording of this webinar and a lot of other demo videos that we have. And then also I put up a link here to our community. And so that's a great place to go if you want input from other users. It's also where we post sneak peeks and give people the opportunity to get involved with new features we're building. So would definitely encourage you to check out our community as well. And then I'll just show you our support center. Yep, so here's our support center. So it's just support.AccuRx.com. And so we have everything categorized in kind of using chain and troubleshooting. And then also this search bar at the top is really useful. So one of our most common questions right now is if you can use your account at multiple practices, and yes, you can. So if that was your question, you can just type in multiple practices, and then the article will come up here with all of the steps to how to get that set up. And then another really common question that we have is just if the toolbar is red. So you can just type in chain is red, and then we'll provide all the troubleshooting steps there. And then another question that has come up a lot is about how to become an approved member of your practice. So the first user to download Chain and create an account will automatically be made an admin. We do recommend that practices have multiple admins at their practice, just so if someone's off that day, that users can get approved. So if you were to wanted to see how to approve a user, just type in approve up here, and then yeah, there are instructions right here. And then also these instructions show you how to make other admins at your practice. And yeah, if you have any questions that you can't find here, you can just click this little chat bubble to start a conversation with me or my colleagues, and we'll usually answer within a couple minutes.
Great. Thank you very much, Annie. So yeah, do check out the support section. We try and make it really comprehensive, and we'll be sure to add more things that came through today. So with that, thanks everyone for joining. We'll let you get back to your evenings. So thanks for joining us on Bank Holiday Monday, although I know many people have been working today. If this has been helpful, let us know, and we'll try and schedule some more webinars for people to learn about new features as we bring them out, and also to understand how to use the features that are out there already. So yeah, thanks for all of your time, and do let us know any questions or feedback. Take care.